What if I told you that a treatment most people associate with smoothing forehead wrinkles might actually help men who have tried everything for erectile difficulties but still aren't seeing results? I know it sounds surprising, maybe even a little unbelievable, but over the last few years, research has revealed something that challenges almost everything we thought we knew about stubborn erectile dysfunction. Gentlemen, I'm Dr. Rena Malik, a urologist who has spent over a decade helping men restore confidence, vitality, and intimacy. And today, I want to walk you through something that is still experimental, not FDA approved, and not included in our official guidelines, but promising enough that you deserve to understand how it works. The idea is simple. Botox, yes, the same medication used cosmetically, may help a specific group of men whose ED is driven by an overactive sympathetic nervous system. To understand why this matters, think about something I often teach my patients. Erections are controlled by the parasympathetic nervous system, the calm system, what we call point. Ejaculation is controlled by the sympathetic nervous system, the stress system, what we call shoot. When your sympathetic system is too active, the body stays in stress mode. You could be dealing with high blood pressure, diabetes, heart disease, or emotional stress, and your body is quietly telling itself this is not the time for an erection. The smooth muscle inside the penis tightens instead of relaxing, and without relaxation, blood simply can't flow in strongly enough to create a firm erection. This is where Botox comes in. Botox blocks the release of norepinephrine, the chemical messenger your stress system uses to keep muscles tense. When we inject tiny amounts directly into the erectile tissue, it relaxes the smooth muscle just enough to improve blood flow. Think of it like turning down a switch that has been stuck on high alert for years. When the muscle relaxes, blood can enter more easily, stay longer, and support an erection that is firm enough for intimacy. The mechanism is very similar to what Botox does in the face, relaxing muscles, but here it relaxes the deep, smooth muscles crucial for penile blood flow. Now, does it actually work? Early research suggests yes, especially for men who have already failed pills and even intracavernosal injections. The first randomized controlled trial included 24 men. Half received Botox, half received a saline injection. These were men who weren't responding to Viagra, Cialis, or injections. And yet 4 weeks after the procedure, the Botox group saw meaningful improvements in erection firmness and overall sexual function. Some of these men were already preparing for penile implants. But after Botox, they were able to get functional erections again. Another study with 176 men tested different doses, 50 units versus 100 units. Both worked at 3 months, but by 6 months, the lower dose started to fade. The higher dose lasted longer, which mirrors what we see in other conditions where Botox is used. On average, men needed another injection around the 9-month mark. Then in 2024, a double-blind, placebo-controlled study followed 70 men who had failed oral medications. At just 2 weeks, the Botox group showed significantly better erections, improved blood flow on ultrasound, and higher sexual function scores. More than half of them achieved erections firm enough for penetration compared to only 3% in the placebo group. A more recent 2025 multi-center trial didn't find improvement for everyone, but interestingly, men who consistently took Viagra along with Botox did see significant benefits. This tells us something important. ED often has multiple causes, and a combination of treatments may work better than relying on one. Real-world data adds to this picture. In a study of 216 men treated outside research settings, 43% returned for a second injection because they felt it helped, usually around the 9-month mark. In my own practice, the majority of men who have tried Botox for ED come back for repeat treatment, which suggests they experience some level of benefit. When we break down the severity of ED, the response rates become clearer. Men with mild ED often respond the best. Men with moderate ED have about a 50% success rate. Those with severe ED, especially those who have failed multiple treatments, respond around 30% unless they combine Botox with pills or penile injections. Then the success rate jumps higher. However, men whose ED is caused by nerve damage, such as after prostate cancer surgery or spinal cord injury, typically do not respond. That's because Botox can help smooth muscle and blood flow, but it cannot restore damaged nerves. Is it safe? So far, the studies show a very high safety profile. The most common discomfort is temporary pain at the injection site. In my office, we use numbing cream, and while the injections are quick, some men still feel brief, sharp sensations. We also place a constriction band for about 20 minutes during and after the procedure to reduce the risk of Botox being absorbed into the rest of the body. Serious complications have been extremely rare. Only one case of priapism, an erection lasting more than 4 hours, has been reported across all studies. And as always, if an erection lasts longer than 4 hours, emergency care is needed because prolonged blood trapping can permanently damage the tissue. It's important to remember that Botox's effect naturally wears off. Just like when men use Botox for other medical conditions, the benefits typically last several months, meaning repeat treatments are necessary. Some studies even noticed that the flaccid penis appeared longer after Botox because relaxed, smooth muscle stretches more easily. But this is not considered a reliable way to increase penile length, just an interesting side effect some men noticed. So who might consider this treatment? Men who have failed oral medications, men who didn't respond to penile injections, men with vascular erectile dysfunction rather than nerve-related causes, and men who are considering a penile implant as their next step. Botox may serve as a bridge before choosing surgery or a supplement to other therapies, but you must understand this is still experimental. It is not FDA approved, not covered by insurance, and most studies have followed patients for only a few months. We still need long-term research and clearer guidelines on exact dosing, technique, and ideal candidates. But the early data is promising, the science makes sense, and for the right man, it may offer a meaningful improvement in sexual function and confidence. My goal, as always, is to give you the knowledge you need to make informed decisions about your health, your body, and your quality of life. If you've been struggling, if you feel like you've run out of options, or if you simply want to understand what's available before making a permanent decision, this is a conversation worth having with your urologist. And before you go, remember this: your health, your confidence, your intimate life, they matter. You deserve care, clarity, and hope. If this information helped you, or if you've watched more than one of my videos, please consider subscribing. It's free, it supports the channel, and it helps me reach more men who need this information but may not know where to turn. Take care of yourself, stay informed, and remember, you're worth the effort.